February, September 15th. Let's say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, so first on the agenda is review and approval of minutes, and that was from our meeting back in June. Do I have anybody have a chance to take a look at those? Anybody have any recommendations for changes or desire to move to approve? I approve. Approve? Second?
Second.
Excellent. Approved. So our last, like I said, our last meeting was June 9th. So obviously we have had an entire summer, which has gone by. Just wanted to mention a few important health dates in September, one of which has already passed, which was the National Suicide Prevention Week, which was last week from September 8th to the 14th. I did see a decent amount of information in the press about this. Another thing for healthcare providers is World Patient Safety Day on September 17th, making doing our best to reduce inadvertent harm to patients with errors. So those are the big events for September. And then obviously our kiddos in the community are back in school. So that's obviously important for health in the area as well. So Dave, we'll start with the communicable disease update. I was going to skip ahead and do the student intern program, but I'll let you do that. Give us a little update about what's been going on.
Thank you. The world of communicable diseases, public health policy, and public health safety has gone substantially crazier in the 3 months since we last met, and it's really hard to speak on any kind of even ground about that. But so I'll start with flu, where I think there's the least amount of controversy. And background activity, these data are from the CDC website, which is the only national level surveillance, and I'm not aware of any local surveillance that is quantitative for flu. And background activity of the A and B viruses is very, very low. There has not been the annual fall uptick of activity as of yet. I have no data for you on the putative efficacy of the current vaccine. So I'm going to restrict myself to what I consider to be a discussion of optimum timing. I think everybody should get flu vaccine who does not have a history of issues or reason not to get it. If you think you have a reason, discuss it with your doctor. That the flu vaccine predominantly provides protection against severe disease and death, but probably has some benefit in reducing frequency of disease. But you can't be assured, if you have the vaccine, that you won't get a case of the flu. You can be assured that it will decrease your probability, that's on a probabilistic, not an individual basis, your probability of having severe disease or death. Because the protection from that flu vaccine is on the 4.5 to 5.5 month area, the optimum timing needs to be discussed because there are usually seasonally two spikes, an early spike and a late spike. If you do what the commercials are recommending and you go get your flu vaccine now, you will almost certainly have no vaccine protection come the spring peak, which usually occurs end of March into April. So my policy for deciding when to give the vaccine is to follow data to the best of your ability, and when you see the first evidence of an uptick locally, you should go ahead and get it. Otherwise, if you don't see evidence of an uptick between October 1st and October 15th is what I always consider to be the best time. That's a clinical judgment that is not an evidence-based, but an anecdotally based assertion. We've had a request for following bird flu. The CDC was taken out of the loop on following bird flu in the animal populations, and it was moved to the USDA. Surveillance is voluntary, so I don't know what the value of the numbers are, but bird flu is essentially endemic in wild birds, migratory and local populations, and it is episodic on domestic birds. So the thing that you follow are outbreaks in the poultry and in the poultry populations, and in dairy cases there are no alarming outbreaks that have occurred since we last met, and there are no new human cases reported there. So on opinion basis, bird flu has been watched carefully as possibly the source of a next highly fatal pandemic. There is no evidence that that has happened. The longer we go without that happening, probabilistically, you might say the lower the probability, but there is some level of surveillance. I would interject that everybody in the public health space will tell you that we have been ill prepared for all of the pandemics that we've seen, and we are less well prepared now for the, quote, the next one than we have. And there's actually a book out by one of the best public health guys out there, Mike Osterholm out in Minnesota. We are really poorly prepared if we were to confront, quote, the next one. RSV, there's an 8-page discussion of exactly who should get which vaccine on the CDC website based on the ACIP committee's recommendations. I would just summarize that the RSV vaccine is recommended for adults over 75, for adults 50 to 75 with a risk factor which includes lung disease, heart disease, immunodeficiency, diabetes, BMI greater than 40, neurologic disease, neuromuscular disease, chronic kidney disease, chronic liver disease, or chronic hematologic disorders. That's one where I strongly recommend you consult your healthcare provider in deciding whether you're going to have a vaccination. October through March are the peaks for the disease, and so vaccination protection is long-lived. So vaccinating now, if you're going to get the vaccine, does make sense. And with regard to vaccinating young children, it is beyond my ken to be able to make recommendations. Please consult your pediatrician, neonatologist, obstetrician, gynecologist for advice in that regard. And that brings me to COVID. Just to discuss the epidemiology, there was another summer peak. It was the smallest summer peak since the outset of the pandemic. It looks to have peaked at the end of June, and we're talking about following cases, ER visits, hospitalizations, and death, which are each one is a following curve from the other. There was a peak in each of them. And again, the peaks were small compared to previous years. The biggest issues now are who should be vaccinated. And it is really, really hard to decide who should be vaccinated. The great political discussion right now is less over who should be vaccinated than who should be paying for the vaccine should you decide that you need the vaccination because you fall into a category of risk. Not included in any of the risk evaluations is the risk either of getting a subsequent infection, of reactivating long-haul COVID if you have it, or the probability of getting long-haul COVID if you have not had it. We do not have any data on the morbidity and mortality of the current predominant strains of COVID, so I don't really know how one would make a recommendation for vaccination in that circumstance, because after the initial phase of pandemic where this was clearly a life-saving and disease-preventing phenomenon, we do not know at this point the degree to which getting the virus will threaten your life, and as a consequence, we don't know the degree to which protection from severe disease and morbidity and mortality will balance the potential of any adverse effects that one might get. So I don't know how one makes recommendations in that regard, and that's all I've got.
Do we mention that the numbers are high right now in the community for Montgomery County for COVID? For
Please.
COVID, I'm seeing it anecdotally at work, and I'm hearing office buildings are out. People are having COVID right now. So I know several people who said their whole floor of their office was out. Yeah, Lisa's nodding her head. I would just remind people to use very good hand washing technique. Some nasal saline is always good to flush out pathogen load. And just be careful at this time.
I think you raise a great point. I restricted my comments to vaccination because that was in and of itself enough time spent on it. But truthfully, all of the other ways in which you can prevent COVID are prevent any respiratory virus should always be emphasized. And I think that real hand washing is critically important. Non-face touching. So develop a habit of not touching your face is also really important.
Especially your eyes and nose.
And
yeah.
if you feel that you have a significant risk, if you're exposed, I also think anecdotally, there is a lot of COVID around now.
Yes.
And by wastewater, there's a lot of COVID around now.
Yes,
The numbers just are not worth, the numbers aren't good enough for me to go into them because I don't know what they tell you. But it is also absolutely true that if you use a well-fitted N95 mask, mask wearing is protective against a lot of viruses, and COVID in particular, which is the respiratory-borne clades. It absolutely has value. What we don't know now is that with all the mutations of the virus, are there other, the original virus was almost certainly respiratory droplets followed by aerosol. It was highly respiratory spread. There was no evidence for fomite spread through the Delta and Omicron variants, but I don't think anybody's looked now to see if there is, because influenza is a predominantly respiratory spread, but a lot of the cases are through fomite spread. And I don't think we really know that. So again, thank you, hand washing. My goodness.
The other thing is testing. So if you're sick and think you may, basically if you're sick, it's prudent to check for COVID and flu. There is some concern, these days, if you can't get in at your doctor's office, you feel like you need to purchase COVID tests at CVS, depending on, who's doing that and their financial feasibility. Just remember, even though we are kind of in the upper part of Delaware County does have free COVID testing available. They have at their clinics, but then they also have the kiosks, which I think we've talked about before. You can go to a kiosk, get the test, do it, put it back in, and you'll hear back from them within 48 hours, but usually less than 48 hours. So there are ways to be tested that aren't dependent on you going out and purchasing COVID tests because, with some question about like what's going to be covered, if the vaccine's going to be covered by insurance, if the testing's going to be covered, can you get the free ones, et cetera. Just know that Delaware County does have that availability of testing.
Thanks.
All right, any other comments? Communicable disease? Yeah, I am also seeing quite a bit of COVID. Our hospital numbers are a bit up. It's not the COVID of 2020. Patients are generally not very sick with it, but it's certainly around. So next on our agenda is our student intern program. So it's the beginning of the year, so we're getting all started up for the program this year. As in years past, our plan is to have 2 interns. I did send our initial email to counselor at Radnor High School, who the first week of school sent it out via Schoology asking for applicants. As in last year, we encouraged it for freshmen, sophomores, and juniors versus seniors because of seniors, just kind of their crazy schedule. And I provided the deadline for the students of September 22nd, which is a week from today, and had noted that they would be notified the week of October 6th. So basically a 2-week gap for us to evaluate applications. I've only received one application so far, but it's not due for another week, so I don't think that means much. Usually the few days prior to the deadline, I get quite a few, as in previous year. So in the past, we've had 2 or 3 people who were involved in screening the applications and reviewing the applications. Usually we kind of break them up. Everybody reviews 3, 4, depending on how many we get, 5, 6, and then kind of gives their top 2, and then the group comes together and then kind of evaluates the top 6 or so of the applicants. So this is my plea for people who are willing to do that. I will once again recuse myself because as I have a daughter in high school, some of her friends may be applying. Bob has agreed and basically graciously said he will absolutely is interested in selecting intern and for being a mentor. So what I need is at least one other person to help select the candidates, and 2 if 2 people are interested, and one other person for a mentor. The other thought, if we don't have anybody right off the bat, would be after we make our selection, then we can see what the students are interested in, and then maybe somebody will be like, oh, that's kind of more up my alley, to volunteer for that. So
I'm happy to mentor again.
Okay.
And I'm
Excellent.
happy to select as well.
Okay. All right.
I'm happy to look at selection. My last day on board is either the November or December meeting, so I can't possibly mentor, but
Right.
I'd be happy to help with selection.
Oh, yeah, so we'll have the selection all taken care of before then. So Leah, Bob, David for selecting. Excellent. Okay, so what I'll do is when I get the applications, I'll add them up, I'll divide them up, I'll send them out to you guys, okay? And then Bob and Bobby for mentoring. Be excellent. All right, great. I'm sure we will get some top-notch candidates as we have previous years. So more about old business, just wanted to remark on kind of planning for this year. We don't have a particular program this evening because my plan was just kind of get started for the year, and I figured people would have conflicts because it's the first meeting of September, which was the case. But I did want to encourage us to think about topics that we feel would be useful for the community, that we could speak on or have a colleague or person in the community speak on. I got some positive feedback about my talk on GLP-1 agonists from June, things that are kind of like in the ether that are talked about that people feel like they could talk to. And it doesn't have to be extensive. It could be a 10, 15-minute presentation that could be also then posted on the website. And obviously looking from the perspective of community-based things that will be helpful, not real medical-based things that patients would learn about. So if you have any ideas for that, suggestions, somebody who could speak, something you're interested in speaking in on, just let me know. All right, so bringing us to new business. So our school liaison, Jenny Lesage, has retired. And so this evening we have Kate Jumper with us from Radnor. Kate, could you just tell us a little bit about yourself? You can just put your mic on.
Sure, thank you for having me. I am the supervisor of student services under our director, Kara Miller. And this is, I'm almost at 1 year in Radnor Township. I started in November of last year as the supervisor.
Where are you located as far as your office? Or
We are in the central administration office right
Central
behind the middle
administration.
school.
Okay,
Yes.
right at the middle school. Okay, excellent. And you're kind of exposed to things from all schools within the
Yes.
district.
Yes.
Excellent, excellent. Yeah, something that we've liked having the school liaison on the board to kind of just speak on, sometimes they're aware of like illnesses that are going through the school community, concerns that administrators have about student health issues, vaping in the past, alcohol use, et cetera. So like anything that you kind of have your ear to the ground to hear about. And then one of the reasons we do the student intern program is so they can kind of bring some of their concerns and hopefully be able to learn something, contribute something from that perspective as well. So thank you so much.
Thank you.
Thanks for joining us. All right, so Maggie is not here this evening for our Board of Commissioners update. I'm going to give a little county update. So the last meeting for the county was June 12th, and the next meeting is, I think, this week or next week. They were also off for the summer. Really interesting presentations, things that are presented at their meetings. One of the things that they did at the last meeting was looking at the highest townships with the highest risk of coronary heart disease and cancer, and then comparing that to the state in general, and basically comparing a lot of conditions to the state in general. So there's some that we kind of are like, okay, that makes sense, like substance abuse, in our deaths from substance abuse in our county are higher in general than the rest of Pennsylvania. The highest incidence of coronary heart disease and cancer, so deaths from coronary heart disease and cancer, Upper Darby was actually first for both of those. Radnor was 10th in coronary heart disease, so it was in the top 10 townships for the county.
How many did they study?
So there were 20. Not necessarily every township, gives the data, but yeah, pretty high number. So it had interesting information like that by township, by county, compared to the rest of Pennsylvania, other counties in Pennsylvania. And that was their epidemiology report, which looks like they do approximately once a year.
Do they put that out to the public?
It's available on the, if you look at the slides from the agenda.
Okay.
The website is decent, but there's a lot of stuff that's kind of embedded into it that if you're not kind of looking for it, it's one thing I think they could do. I mean, they don't want to make the website too complicated that if somebody goes to find out where they can get a COVID test, they don't want it to be too complicated. Sure. They can't find it. But like that data was kind of buried within a presentation from their meeting. Yeah. But they do have things that are more clear, like their community health improvement plan, which I think we had talked about in the spring, which includes their their top goals: reduce substance abuse, decrease breast cancer deaths. What their goals are. That is very kind of there's basically the steps they're taking to obtain those goals are well documented on the web page. Right. One of the things that they're doing, which was slowed down a little bit due to shortages with Jefferson, but they're these are our plans. We want to reduce breast cancer deaths, so we're going to have portable mammography, which was done in concert with Jefferson throughout the county. So, for example, they have what their goals are, and then ways that they're trying to, and then looking on the website, you can find those actions that they're trying to take. So it's really, it's becoming a very good website resource. It's not too, it does have, reports deaths, flu deaths. I mean, you can find lots of stuff. I'm not sure it's the most up to date because usually it's a few months behind. But very helpful and interesting to see what they're doing. So I'll take a look at those and keep everybody up to date if there's any big new things like the kiosks that they had last year. But yeah, the portable mammography is pretty cool. All right. Any questions regarding? county update? Okay, great. Now's the time for public participation. I don't think we have anyone in person today. I do believe that we received a email public comment, so what we'll be doing is we will include that in our report for this evening's meeting, and then we will address the comment next board meeting, which I believe is October, let me make sure I got it right. October 20th at 5:30. Anyone have anything to add or discuss? It's an early meeting, early in the year. All right, I will adjourn the meeting.